As all of you know, BC's vaccination campaign is going very well. One of the most impressive levels of vaccination in all of the world. 82.3% of those eligible, those over 12 as of today, have received their first dose of a COVID-19 vaccine, and 71.6% are fully vaccinated. The numbers of those partially vaccinated, of course, is declining significantly day on today, and the gap between first dose and second dose, those numbers, is declining significantly and will continue to decline significantly throughout the month of August. The priority that we've given and we give to long-term care and assisted living residences during this pandemic is significant, and certainly has been our top priority in terms of vaccination. We started vaccination in long-term care. It was the highest priority of all places in British Columbia in December of 2020, and have continued that effort of vaccination throughout our long-term care and assisted living homes since then. And the impact was immediate and dramatic. We went in a few short weeks from 49 care home outbreaks on January the 15th in British Columbia to almost none in the month of February, which shows the impact and the value of vaccination for those living in long-term care and for those working and helping people in long-term care. I want to recognize the exceptional work done in all our long-term care and assisted living homes by care staff, those who keep facilities clean, those who provide food, our nurses, doctors who work and support people in long-term care, health sciences professionals, pharmacists and others who do all of the work to support residents in long-term care. All those who work, especially in these difficult times when visitation has been limited in long-term care, to provide social and other supports for long-term care residents. People in British Columbia are grateful, and I am grateful for all the work that has been done. In terms of those working in long-term care in particular, we've given priority to those vaccinations, and you've seen those numbers across BC, more than 40,000 people working in long-term care. A very significant number as well in assisted living have been vaccinated since the beginning of the pandemic. A number of weeks ago, we announced new measures to ensure protection for those living in long-term care. Those measures included work on an order to ensure that we knew the vaccination status, public health knew the vaccination status of everyone working in long-term care by care home and by individual. And secondly, the intention to ensure that everyone who is not vaccinated be tested, that everyone who is not vaccinated have requirements for PPE that were more than those who were vaccinated. Of course, in this period, in this time, we're seeing additional cases of COVID-19 across BC, more than 500 yesterday, and cases in all regions of province. We've also seen some increase in the number of outbreaks. Those outbreaks are not qualitatively the same as they were in the months of January and February and December and November of last year. Nonetheless, they are disruptive. People in long-term care, living in long-term care in particular, are vulnerable, and especially vulnerable to COVID-19, as you know. And the fact of an outbreak, I can tell you as Minister of Health, but also as a family member, is incredibly disruptive and painful to residents in long-term care, to their families and everyone else. It means limits on visitations and limits on life after a year of limits on visitations and on life, and on the fulfillment of life in long-term care. So today, Dr. Henry will be announcing some new orders to ensure the following: that everybody who works in long-term care and assisted living be vaccinated. This is a necessary step to take to protect residents and to protect staff in long-term care. We know, with variants of concern, that there is continuing risk for people living in long-term care, even vaccinated, and the risk of disruption continues to be high. And we think that this additional step to the significant steps we took earlier on, and we have announced our intention to take earlier on, that this additional step will add to the safety and the protection of all those working in long-term care. I want to thank everyone working in long-term care. And now I'm going to introduce Dr. Henry to go through the details of the provincial health orders. Dr. Henry.
Thank you very much, and good afternoon. We are here today, as mentioned, to announce important new public health measures for long-term care and seniors assisted living here in BC. As we have across the province, we've made excellent progress in our vaccination effort, and as mentioned, over 72% of people now are fully immunized. Particularly, this is important for people who are in those most vulnerable areas in long-term care and assisted living. And we, however, continue to see transmission, particularly amongst unvaccinated people and pockets where immunization rates are lower. This transmission is of particular concern in seniors and elders living settings. The risk is changing. As we have started to see an increase in much needed activities in our life, we have more people being able to come together, to go to work, to do all of those things that we've been missing in the last few months. And as well, we have the introduction of new variants into the province, including the Delta variant. And we've seen the impact of that in long-term care, where we now have 8 outbreaks introduced by unvaccinated people. And once we have recognized that once it gets into these highly risky settings, it can spread even to those who are immunized. And we've seen spread both to residents and staff, causing illness, but also disruption in the life of people in long-term care. Early in the pandemic, we recognized our seniors and elders living in long-term care and seniors assisted living were particularly vulnerable to severe illness and death from COVID-19. That's the setting where we have seen the majority of deaths, and severe restrictions needed to deal with outbreaks have affected their quality of life for far too long. That's why we took immediate actions last year to restrict movement of staff between long-term care and assisted living and assure access to PPE, and why we prioritized as the first part of our immunization program staff and workers and residents of long-term care. Today, we need to take an additional step to reduce transmission. We are announcing mandatory vaccination as a condition of employment for all workers in long-term care and seniors assisted living. This will apply to all licensed facilities, whether they are private, health authority owned and operated, or contracted facilities. The requirement will be made through a provincial health officer order that will have a number of things in place. Primarily, the new order will ensure that information on all workers in long-term care is provided to public health so that we can verify immunization status and have an understanding of the immunization status by facility of both residents and staff. That helps us in assessing risk and assessing outbreak potential in those facilities. In addition, we will have the implementation in the interim of the requirement for unvaccinated staff to wear masks and additional PPE, as well as being tested regularly. We will then be working with the individual staff, individual facilities to make sure that every person has access to vaccination and has their questions answered. And everybody, all workers in all facilities will need to be fully vaccinated by October 12th of this year. I recognize that this is a change from the direction that we announced earlier in the spring, in June, where we thought it would be sufficient to have additional measures such as testing in place. We have now seen with the transmission of the new variants that we need extra protection in this highly risky situation. Even when resident immunization is high, as it is across the board in facilities in this province, we have seen transmission from unvaccinated staff, and it has reinforced the need for protection from all people in long-term care. So it is a change, but it is based on the situation that we find ourselves in now and how we need to deal with the data that we receive and take the necessary measures to make sure that we can get through this new transitional phase that we are in through the fall, when we also expect to see increased risks with other respiratory illnesses. This new order will also apply, the new PHO order will apply to volunteers and personal service workers who go into long-term care facilities. And it will apply immediately. We'll no longer allow anybody who's non-vaccinated, who's not fully vaccinated, to be a volunteer or to be a personal service provider in the long-term care assisted living facilities. We understand there are reasons why a small percentage of people may be unable to be vaccinated for medical reasons. And in those rare exceptions, public health will be working with those individuals, with the employers, and we will also be working through the next little while with unions and with owners and operators and public health to ensure that we have all of the provisions in place for people to make sure that we can get as high immunization rates as possible and support people through this process. I do also want to take a moment to thank each and every resident, care worker, nurse, healthcare practitioner, the people who provide the food services, the cleaners and workers in long-term care. We know this has been the most challenging time for all of you, and I know everybody has stepped up to do their part. And to the families who have entrusted these facilities to care for your loved ones, we know how challenging this has been for you as well. This is one additional measure which will ensure that we have the best protections possible to prevent outbreaks, to prevent the introduction of this virus into long-term care facilities and assisted living, and to make sure that we can return to the quality of life that our seniors and elders deserve. I will also take a moment to say that the reporting requirements for that are part of this order will apply to healthcare workers outside of long-term care and assisted living, so in acute care and community care. And we will be working with health authorities, with unions, and determining our path forward for all healthcare workers in British Columbia in the coming weeks. So I just want to say thank you, and we're happy to take your questions.